Hi Kylie, my name is Lauren. I'm going to be your student nurse for the day, and I'm going to be assessing your complete checkoff. Is that alright?
Yes.
Alright, so before I begin, I'll wash my hands. So to begin, I'm going to be doing your general inspection. So I'd be looking at your skin, hair, and nails. So I'm just going to go ahead and quickly just look over the skin on your legs, your arms, and your head. And your skin is a light tan. I don't see any abnormal moles or any scars or marks anywhere. And as we go through this, I'm going to be checking the skin where, like on your stomach and areas that I can't see right now. So I'm going to look at your nails as well. And I'm not seeing any white spots. Your nails are fastened in their beds, which is good. And I'm going to look at your toes too. No white spots, and they're fastened in their bed as well. Good. Alright, so now I'm going to be looking at your head. So I'm going to have, if it's alright with you, I'm going to have you sit up and turn to the side. Thank you. So first I'm going to be looking at your hair, and your hair is thick. I don't see any dandruff in your scalp, and your hair is a brown color. I'm going to palpate your head to feel for any nodules or masses. And I do not feel anything there. So after that, I'm going to be looking at the overall shape of your face. It is oval. And then I'm going to be checking your cranial nerves 5 and 7. Cranial nerve number 5 is your trigeminal. So what I'm going to have you do is clench your teeth in your mouth. Yes. And I'm going to feel your masseter muscle and your temporal. And they have good strength to them. Now I'm going to put my hand underneath your chin. I'm just going to have you try to open your mouth. Good. So it was good against resistance. So after with the trigeminal nerve, I'm going to be doing pain and light touch. So this would be, the pencil will be the pain. So I'm going to let you know what that feels like. And then light touch is the cotton ball. So I'm going to be doing your forehead, your cheek, and your jawline. So I'm going to have you close your eyes, and you're going to tell me if you feel pain or light touch. Light. Pain. Pain. Light. Alright, good. So after the trigeminal nerve, I'm going to be checking your facial nerve. So what I'm going to have you do is I'm going to have you smile, frown, raise your eyebrows, puff out your cheeks, and show me your teeth. Good. And then I'm going to have you clench your eyes really tight. And then I'm going to try to open them, try to keep them closed. Alright, good. You showed good muscle. You had good strength in your muscle. So now I'm going to be checking your nodes. So I'm going to be checking I'm going to check your preauricular, your postauricular, your occipital, your tonsillar, your submandibular. Then do your submental with one hand. Then I do your superficial cervical chain, your posterior cervical chain, your deep cervical chain. Then I'm doing your supraclavicular, which is above your clavicle, infraclavicular, which is below. Alright, now I'm going to do your lateral, which is on your arm right here. Your central, which is in your armpit. Your pectoral, which is right here. And then your scapular, which is underneath your scapula right here. But I do it skin to skin, so I have to come back here and feel for that. Alright. After your nodes, I'm going to be looking at your... Oh, and with your nodes, I didn't feel any of them. They weren't swollen or anything like that, so there was no abnormalities. So now I'm going to be moving on to your eyes. So first I'm going to check your cranial nerves 3, 4, and 6, which is your trochlear, abducens, and oculomotor nerve. And I'm going to begin by looking at your ocular movements. So first I'm going to start with the 6 cardinal fields of gaze. So I'm just going to have you follow my pencil. Alright, I did not see any jerkiness movements of the eye, so you have no nystagmus. After the 6 cardinal fields of gaze, I'll be getting my light, and I'll be shining it at the bridge of your nose, and I'll be looking for your corneal light reflex, so I'd see the light in both of your eyes. And I do see that, so you have good corneal light reflex. After the ocular movements, I'm going to be checking your conjunctiva, sclera, and your lids. So for the conjunctiva, I'm going to be using my thumbs, and I'm just going to pull down your lower eyelids to see the color. Your conjunctiva are pink. They are moist, they look good. After that, your sclera, it is china white. It's not having any yellow colors to it. And then your lids are symmetrical. You don't have any lid lag or one that's lower than the other. After your conjunctiva, sclera, and your lids, I'll be checking your pupils. Okay, so your pupils are round and equal. They are symmetrical. I'm going to be checking your direct and consensual reaction to light. So I'm going to have you hold up your finger bridge. Good. And so for the direct reaction to light, I'm going to come in from this side and see your pupil constrict, and it does. So I'm going to let it go back out, and then I'm going to be doing the same thing, but I'm going to look at this side for the consensual. And that pupil constricted as well. So after I do that, I'm going to be looking for accommodation. So I'm going to get my pencil. I'm just going to have you follow my pencil all the way down to your nose. Good, and you had good accommodation there. Now I would be checking for your visual acuity, which is the optic nerve 2, cranial nerve 2. But I'd be using a Snellen chart, so I'd have it over here on my door. But since I do not have one, you'd say you have 20/20 vision, so you'd be able to see the bottom line and from 20 feet away, which is normal. After the visual acuity, I'll be checking your eyes with the ophthalmoscope, but I do not have one of those here, so I'm just going to use this right here and pretend this is my ophthalmoscope, and I'm just going to come from the side, and I'd say that I could see you. Open your eyes. I would say that I could see your red reflex. I can see the color. I'd come in from here too. I can see the color of your periphery, which is a creamy orange. Then for your vessels, your veins are purple and bigger, while your arteries are red. They did have some crossovers, which is normal. Your optic disc was well defined and a creamy yellow. And your macula is on your temporal side, and it is 1 disc diameter in length and 2 disc diameters away from the optic disc. So after your eyes, I'm going to go ahead and go on to your ears. So first I'm going to be looking at the external structures of your ears. Your pinnas are symmetrical. You do have piercing, so that would be a lesion, and I'm just going to palpate for any nodules or anything that I feel that is abnormal. Alright, I don't feel anything like that. So now I'm going to be checking your, I'm going to use my otoscope, but I don't have one of those. So I'd come in and I'd look in your ear. And I could see your tympanic membrane. It was pearly gray. I could see your short process, your long process, and your umbo of your malleus, and I could see the light reflex in your ear. After the internal structures of your ear, I'm going to look at your external canal. So I'm just going to look in here for any inflammation or any drainage, and I do not see anything in there. And with your ear, I'm going to be checking your acuity, which is cranial nerve number 8, and I'm going to have you occlude this ear over here with your finger. And if you just turn to the side, yeah. So occlude that ear, and I'm going to whisper 3 words behind you, and you tell me what 3 words I say. Cat, dog, mouse. Good. And so I'll have you turn back around, and I would now be checking for lateralization with my tuning fork. So I would bang my tuning fork, and I'd place it on your head, right here, and I'd have you raise your hand whenever the sound stops. And could you hear it in both ears? Good. Now I would be checking for the air conduction and bone conduction with my tuning fork on this side. I'd bang my tuning fork and place it on your mastering process, and I'd have you raise your hand whenever you stopped hearing it. Alright, and then I would switch it over so you could, for air conduction in front of your ear, and you just tell me when you stopped hearing that. Good, okay, and your air conduction is twice as long as your bone conduction, which is normal. So now after the ears, I'm going to be checking your nose. Head, yes, your nose. So I'm going to be looking at the external structure of your nose. It is symmetrical and midline to your face. I'm going to check the patency of your nose. So I'm going to have you occlude one nostril and sniff, and then do the other side. Good. Now I'm going to check your cranial nerve number 1, which is the olfactory. So I'm going to check if you can smell. So I'm going to have you close your eyes, and I'm going to have you smell something. I just need you to tell me what you smell.
Strawberries.
Good. Alright, after your nose, I'm going to be checking your oral cavity. So first I'm going to look at your lips. Your lips are pink, they are not chapped, they are moist, which is good. They are also symmetrical. You aren't lagging on one side, which is no signs of Bell palsy. So now I'm going to look at your buccal mucosa and your Stensen's duct. So I would get my tongue blade, and so I'd have you open your mouth, and I just push to the side. Your buccal mucosa is pink and moist on both sides, and I do see your Stensen's duct, which is at the second molar on the upper part of your mouth. After checking the buccal mucosa, pink, moist, Stensen's, I would check your teeth. So you have you had any wisdom teeth taken out?
No.
Okay, so you have 32 teeth. They are, can you smile for me? They are white. Now I'm going to check for occlusion, so I'm going to get my tongue blade here. I'm just going to put this inside your mouth. I'm just going to have you bite down. Good, your upper teeth rest over your lower teeth. I don't see, I'm going to get my pen light out. Open your mouth, please. I don't see any cavities or needs for repair, so that looks good as well. After checking your teeth, I'm going to be looking at your palates and your uvula, which is cranial nerves 9 and 10. Yes. Okay, so I'm going to have you open your mouth. Your hard palate is a little bit lighter than your soft palate. Your soft palate's pink, so I'm going to have you say ah. And your uvula rose and fell midline. So now I'm going to be checking your tongue, which is cranial nerve number 12. Which is the hypoglossal. I'm going to have you stick out your tongue, and I don't see any tremors, so now I'm going to test the strength of your tongue. So I need you to put it against your cheeks on the inside, and that looks good. You have good strength. After the oral cavity, I'm going to go to your neck. So the general structure of your neck, it widens at the base. It is symmetrical. I don't see any masses or nodules on your neck. And the skin of your neck is good. It's a light tan, no abnormal moles or any abnormalities there. So now I'm going to be checking your trachea and your thyroid. So for your trachea, I'm just going to check if it's midline, and it is. So I'm just going to move it back and forth. Good, and it should be movable. So now I'm going to check your thyroid. So I'm going to have you turn this way. I'm just going to get behind you so you can see what I'm doing. And so I first find your trachea, which is midline. Okay, so now I'd have you hold your head down and to the right. Good. And so I'd just place it with my left hand, and I'd fill with my right. Good. I'll have you swallow. Good. So that looks good. So after your thyroid, I would be, you can turn back around. After your thyroid, I would be checking your I check your muscles in your neck. So I'd have you, for your sternocleidomastoid, I'd have you turn left and right. Good. And then I'd have you do it against resistance. Good. And then for your trapezius, I'd have you shrug your shoulders. And then I'd have you do it against resistance. Good, that feels good. After your neck, I'm going to move on to your chest. Alright, so for your chest, I'm going to go ahead and have you lay down. And I'm going to get the blanket because I'm going to have to be listening to your lungs. Okay. So I'd use this blanket to cover up the bottom. I'm going to make a tube top. I'm just going to pull your shirt up a little bit right there. That looks good. Alright. So I'm doing your chest. So I'm going to look at the overall contour and tone of your chest. And your chest is symmetrical bilaterally. And I'm not seeing any masses or nodules. I actually come up here a little further because this is your abdomen, so I'm going to come up here to your chest and just look there. Okay. And normally you probably wouldn't have a bra, and I'd just make a tube top out of it if I was at the lab. But I'm not. Okay, so the shape of your chest, your AP, should be half of your transverse, and it is, which is normal, and that means you don't have a barrel chest, so you don't have any signs of COPD. Now I'm going to be checking if you're a chest breather, so I should be coming down to the side and looking at you breathe, and you are. Most females breathe with their chest, while males breathe with their abdomen. So now I'm going to be getting my stethoscope, and I'm going to be listening to your breath sounds. So actually, I'm going to have you sit up. Sorry about that. Okay. Let me just leave this blanket on the bed. Because we're going to be down there soon. Okay. I'm going to warm this up a little bit. So every time you feel my stethoscope on your back, I'm just going to have you breathe. Now do your front real fast. Alright, and your lung sounds, they are clear. I didn't hear any adventitious sounds like crackling or wheezing. So now I'm going to check your cardiovascular. So for this one, I'm going to go ahead and have you lay down. Okay. So I'm going to have you roll up your shirt. Up for you. Okay. So for your cardiovascular, I'm first going to check your radial and apical pulse. So I'm just gonna do your radial for it. Let me get my watch so I can count the time. Alright. So for radial, I'll be doing it at your wrist. And I'd be counting for 15 seconds, and then whatever I get, I multiply by 4 to get your total. So I'm going to start. Okay. So in 15 seconds, I got 15 beats. So 15 times 4 would be 60, which is good. It's better than mine. Okay, so now after the radial pulse, I'll be checking your apical pulse, which is, I'm going to have to place this underneath your left breast. So I'm going to put this in my ears. And I want to check this one for 60 seconds. for your apical, I got 64 beats, which is close to what I got for your radial. So after checking your apical pulse and your radial pulse, I'm going to be auscultating. So I'm going to be doing the 5 different areas, which is the aortic, pulmonic, herbs, tricuspid, and mitral. So I just want to come back here and lift up your shirt. And so first, I'm going to be listening with my diaphragm side, and then I'm listening with my bell for murmurs. So first, I'm going to start with the aortic, pulmonic, herbs, tricuspid, and mitral. I'm going to do it with my bell side. Aortic, pulmonic, herbs, tricuspid, and mitral. Alright. So for all those different areas, I heard your S1 and S2. I didn't hear any murmurs with the bell side of my stethoscope. Yes, so I think that covers that. Okay, so now I'm going to be checking your carotid arteries. So I'm going to do one side at a time, and I'm going to do this side first. I'm just going to feel for the pumping. And that is strong on this side is a 2+. I'm going to check this side. And that is also a 2+. So now I'm going to check for your jugular, the jugular venous distension. So I'm going to have you raise your head like 45 degrees and then turn a little bit to the left. Okay, I don't see any jugular distension there, so I'm going to do the other side. And I do not see any jugular distension on that, so you can lower your head. After the jugular venous distension, I'm going to check your pulses. So I'm going to check them bilaterally. So I'm going to have you hold out your hands like this. I'm going to check your brachial. That's strong. That's a 2+. Your radial. That's a 2+ as well. I'm going to check your femoral. So I'm going to have you bend your legs right there. Okay, so if you come down here real fast, I'm just going to check those. Those are strong. That is also a 2+. I'm going to, you can lower your legs. I'm going to check your dorsalis pedis, which is above your big toes. Check those. And that's a bit lighter, so I'd give that a 1+. And then your posterior tibialis, which is behind your inner ankle. And that is also a bit lighter. I would also give that a 1+. So after checking your pulses, I'm going to be going down to your abdomen. So first I'm going to be, I'll carry you back up so you're not cold. So I'm going to raise your shirt up and look at your abdomen. Okay, so first I'd start in your right, no, I'm looking at your overall contour and tone. So the contour of your abdomen is symmetrical, it is flat. So I'm going to be listening to your abdominal sounds, and I'm going to start in your right lower quadrant. I'm doing these in a zigzag motion. Alright, so you have really good bowel sounds. You're supposed to have 5 to 30 per minute, which is, and you did, it was irregular, which is good. So after the bowel sounds, I'm going to, first I'm going to look for any abnormalities on your stomach, like stray scars or marks, and I don't see any there. Your skin on your abdomen is a light tan. It's just like the rest of your body, which is good. After the scars and marks, I'm going to look for light and deep palpation. So for light, I'm just going to barely go like 1 to 2 centimeters in. I'm just going to feel around. And just tell me if you feel any pain or tenderness. Any pain or tenderness?
No.
Alright, so for deep, I'm just going to use 2 hands. And I'm going to do a dipping motion in. Just tell me if you feel any pain or tenderness.
No.
Okay. Good. So now after palpation, I'm going to do percussion. So I'm going to be listening for dullness and tipping. So I just get 1 finger and I just hit it. Good. I heard dullness over organs and tympani everywhere else. So after your abdomen, I'm going to do your musculoskeletal. So for this one, you are able to sit up. Okay. So for your upper extremities, I'm going to check your abduction, which is away from the body. Just do what I do, and your adduction. Good. Now I'm going to do your flexion. So flex your arms and extend them. Good. So now I'm going to do the same thing with your legs. Just do flexion and extension. So flex. Well, first extend. Do both legs. Good. Now flex. Good. So after the upper and lower extremities of the musculoskeletal, I'm going to check the overall strength of your arms. So I'm going to have you grip my 3 fingers and grip it as hard as you can. Good. So now I'm going to have you hold your hands in front of your face like this, and I'm going to try to push them, and you just try to hold me back. Good. So you have good strength in your arms. After your arms, I would check the strength of your no. Okay, now I'm going to do the range of motion of your arms and legs. Okay, so I had to do the flexion and extension. So let's do pronation and supination. So for pronation, have your hands like this. Now for supination, I'm going to have you go like this. Just try to like that, like holding your ball. Good. So for pronation, you just have to go back down. Good. So your range of motion is good. Then I'm going to check your spine. So I'm going to have you stand up. Alright, just turn to the side. I'm just going to have you bend over, and I'm going to bend over at your waist. Good, I'm going to have you palpate. I'm going to palpate your spine. Alright, good. Your spine is midline. I didn't feel any abnormalities with it. Your posture while you were sitting was good. So I'm going to have you go ahead and sit back down. Okay. So now I'm going to check your nervous system. So I'm going to ask you 3 questions. So what is your name?
Kylie.
Where are you?
Your room.
And what is today?
Wednesday.
Good. So you're oriented ×3. Now I'm going to check the motor of your upper extremities and lower extremities. So for motor, I'm going to have you flip your hands against your legs and then tap your legs. Okay, good. And then for your legs, I'm going to have you stand up. I'm going to have you walk on your toes. Good. And I'm going to have you walk back on your toes. And then I'm going to have you walk on your heels. And then walk back on your heels. You didn't have to walk backwards. You could just turn around. But that's okay. You did more than was asked. Okay. And so you can sit back down. And so I do not see any like weird spasms or anything. So you have no involuntary movements. So after the nervous system, I'm going to check your deep tendon reflexes. Alright, so first I'm going to start with your biceps. So I'm just going to have you flex your arm. Alright, I'm going to do this one so they can see it. Alright, so you can loosen up a little bit. I can find your tendon right there. And so what I do with my hammer, if I had one of those, sorry, the reflex hammers, I would just hit that tendon and your arm would go up. Now I'm going to check your triceps. So I'm going to have you extend your arm out. Alright, and I feel the tendon there. You can relax your arm. So I'd hit there and your arm would go out for the triceps. Now for your patellar, which is your knee, I'd come down and I'll go ahead and have you extend your leg for me. Alright, so you can let it relax it. So I'd hit up right below the knee and your leg would go out. And then after the patellar reflex, I do your plantar. So I'd have you lay down in bed. And for this, I'd use a pin. And so I'd make a upside down 7 and your toes are supposed to curl in. And curl in. Good. So that looks good. For that reflex. Now after the plantar reflex, I would lastly do pain and light touch again, but I'm going to do it on your body. So I'd have you do the same thing I did on your face, but you just tell me if you feel pain or softness on your arms and let your arms off. So I'll have you close your eyes. Just tell me if you feel sharp or soft.
Soft. Sharp. Sharp. Soft.
Alright, good. That looks good. Do you have any tenderness or any pain at all?
No.
Alright, good. So that would be the end of our assessment. I'm going to wash my hands.